A lot of questions from people that visit my website, and I've asked Barbara here to go through some of those with me. So if you'd like to kick off with the
Okay.
first question, Barbara.
We'll start with our first question is from Celia. Can you have Botox while breastfeeding?
Okay. So you can't or shouldn't. Most medications, and Botox is no different from many of the others, it's not recommended that you have Botox if you are pregnant or breastfeeding. It's really because no research has been done on it. I have had patients that have subsequently become pregnant, and there are many cases out there, so there's not a problem about that. But in terms of consenting someone, it's not advised that you do that. I mean, the other thing is when you're having Botox, you've got to be careful. There are other contraindications, so you shouldn't be injecting Botox into any areas that look infected or any inflamed areas particularly. So yeah, really not a good idea to have it when you're pregnant or breastfeeding.
Okay, good. Our next question is from Julie. She's 57 years old and feels she looks tired and wants a more refreshed look. She booked an appointment for an aesthetic consultation and wants to know what questions she should ask.
So the aesthetics, it's a bit of a wild, wild west. So it's, I think, very important that when you go to see someone, you do ask a lot of questions. You want to find out more about the experience the practitioner has and what regulations they have, which bodies they are, um, whether they're with the GMC or the GDC, the dental or the nurses, what kind of qualifications they have behind them. You want to find out what kind of experience they've had in terms of particular procedures, and you would like to see some of their before and after photographs to see kind of the results they're getting. You want to be knowing what kind of products they're using. I'm so surprised that patients, when the new patients that come to me, they've had treatment somewhere else, but they don't know what they've had done or had injected into their face, which for me is quite a surprise. I would like to know what someone is putting into me. So there are good and there are bad products. In fact, there has been some counterfeit Botox out there. You've probably seen it in the papers. So yeah, a lot of due diligence really when you go to see someone, and take your time and ask lots of questions. Do your preparation before you actually have the consultation, and write all those questions down. And, and the other thing that we do as practitioners, or should do, is allow patients to have a cooling off period. So they shouldn't be obliged or feel forced to continue with the treatment on the spot. They should be allowed to go away and think about things, and if necessary, come back with more questions. And of course, behind all of that, you need to have a thorough assessment and what recommendations that practitioner is offering, what is suitable, what is not. So all of these things, yes, to be taken into consideration, and don't feel rushed in moving forward with any of these procedures or treatments.
Very good advice.
Yeah.
Very good. Take your time, ladies.
Mm-hmm.
Janine wants to know what's the difference between baby Botox and Microtox. I'd like to know that myself.
So I think there has been some more talk. Baby Botox is a kind of a softer Botox. In fact, it's what I've been doing for years because it provides a more natural look with movement, not frozen look. So that's typically what we call the baby Botox. And I think there may be confusion with Microtox in they thinking that's the same, but there is now treatments where you can have much, much smaller doses spread over the skin, affecting the skin only, not the muscles. So it's not about stopping wrinkles, formations, or folds and that kind of stuff. It's really looking at skin quality and texture. And I think you'll probably see more of this come out in the future. It says that Microtox will improve the skin quality, it will reduce the pore size, and And so some of the patients are wanting to have it for those reasons.
I still don't understand the difference.
Microtox is extremely small doses into the skin, and baby Botox is smaller doses but injected into the muscles.
Okay.
Yeah.
So muscle versus skin.
Muscle versus skin. Not much Microtox is done at the moment, but it may be. There's more research, I think, to come on that.
And that's the end of this particular segment.
Thank you. So if you do have questions, please go to my website and then submit them through the email there. Thank you.